Hi everyone, welcome back to Musculoskeletal Part 2, Support Structure, Trauma, which are going to include, excuse me, sprains and strains and of the tendons and ligaments, and tendinitis, tendinosis, bursitis, those types of things. So let's start here with strains and sprains. So a sprain and a strain, now make sure you know the difference between the two. A sprain is a stretching or tearing of ligaments, okay? The fibrous tissue that connects bones and joints. Most common types are ankle, thumb, wrist, knee. Excuse me, I'm sorry. And a strain is a stretching or tearing of muscles or tendons, which are tissues connecting muscles to the bones. Okay, there's a little difference between sprains and strains, and so I definitely want you to know that. For both, they manifest with pain on palpation, difficulty with range of motion, swelling, tender, sometimes bruising. They may immediately bruise. So you can see this right here, tearing of the muscle right here, which would be a strain, whereas this ligament right here was stretched or torn, and that makes it a sprain. Whoops, I should do this. That's better. Okay, the next one is tendinitis, tendinopathy, and bursitis. So tendinitis is an inflammation. Itis means inflammation of a tendon. So you can see there's some injury here and it's been stretched or pulled, and they get some tendinitis of stretching a tendon or straining a tendon. Tendinosis is osis meaning disease. So it's a painful degradation of collagen fibers. So this is something serious that's more of a disease process. The muscle is degrading, okay? It's not just an acute injury. Tendinosis is chronic, and you can kind of see how these muscle fibers are just breaking down. Bursitis, inflammation of a bursa. And bursa right here, you can see these are bursa right here. So that's an inflamed one. So this is this bursa up here, these sacs, and they're lined with synovial fluid, and they have a synovial membrane around it, and they're called bursa. They tend to be located among the tendons, muscles, and bony prominences, okay? Prominences. So here are bursa, healthy bursa, and if somebody has an inflammation of these areas, we call it bursitis. You can see the inflammation of this bursa right here, and they tend to be caused by just repeated trauma, overuse of the joint area. Tendinopathy and bursitis. Okay, tendinopathy and bursitis. Epicondylitis is an inflammation of a tendon where it attaches to a bone. Sorry, I'm looking for something here. So when we talk about epicondylitis, when we talk about this area, we're going to talk about tennis elbow or golfer's elbow. So epicondylitis, the epicondyle right here is a bone protrusion. So see this right here, this protrusion of the bone, it's an epicondyle. That's a lateral epicondyle, medial epicondyle, the protrusion of a bone right here. So an inflammation of that is a painful inflammation or tenderness that surrounds this epicondyle area right here. And there's two common types of epicondylitis, a lateral epicondylitis right here or a medial epicondylitis. A lateral is what we call tennis elbow, and you can see it right here. tennis elbow, also called a lateral epicondylitis, causes pain on the outside of the elbow. If you're a tennis player and you've ever gone that, you get that pain, you can put your finger and you can just right on the lateral part outside of the elbow. And I have that, so I just always know right where to put my finger, and when I push that pressure point right there, I always get some pain on the outside. Tennis elbow. Now, here in the medial epicondyle, if that gets inflamed, we call that golfer's elbow. And then inside right here, medial epicondylitis causes a pain on the inside of the elbow area right here in this medial epicondyle. And that's the difference. So this is something that's very common. Tennis people say, oh, I got tennis elbow, I got golfer's elbow. And that's actually what's going on with them. Treatment for tendinopathy and bursitis, systemic analgesics, ice, heat, local injection of an anesthetic. Maybe they need a corticosteroid to reduce the inflammation. For bursitis, sometimes the fluid can go away with anti-inflammatories and ice and corticosteroids, or sometimes it needs to be aspirated and drain the fluid, and then certainly physical therapy can be helpful. So as far as diagnostics, plain x-rays may reveal soft tissue swelling. MRI of a joint, especially a knee or shoulder, reveals location and degree of injury. And we know from nursing school treatment is price. Treatment for soft tissue injuries and closed fractures. P, we want to protect the injury, stop using it, give it a break, rest it, put ice on it. This says comfortable support and apply a supportive bandage, which you can really, the C is often compression. Put something, a compression brace on it to kind of support it, and then E, elevate to reduce swelling. So this is really the treatment that we start with patients, and then can move on to medications. And the last thing I want to talk about here is rhabdomyolysis. And rhabdomyolysis is a breakdown of muscle that causes a release of intracellular components like myoglobin. Myoglobin, it's important to know. Why is it? There we go. And it comes from the muscle and it moves into the bloodstream, rhabdomyolysis. So there's a muscle injury, and then the muscle breakdown that occurs because of the injury releases myoglobin, and it then gets into the bloodstream. And then once it gets into the bloodstream, it moves through, obviously, through the kidneys for filtration. And the myoglobin can cause some kidney injury. It can kind of get stuck in these nephrons in here. And what happens is the urine that comes out that has this myoglobin in it gives a reddish or brown colored urine. It's called Coca-Cola urine. And we can see that, the myoglobin in their urine. Seen in patients who have been immobile for long periods of time. The skeletal muscle breaks down. So a couple things here that are kind of helpful. Often we'll see some renal failure based on these lab values, an increase in creatinine and a decrease in GFR. As creatinine increases, glomerular filtration rate decreases. Remember that. A total CK level or CPK level 5 times the normal. So a CPK, creatinine phosphokinase, or a CK is evidence of skeletal muscle breakdown. We all have some skeletal muscle breakdown. That's just part of moving. And if you do a workout, you have even more. But what happens is that level comes back high. So just 5 times the normal. Liver enzymes can also be affected and they come back high. This says tea-colored urine, Coca-Cola urine, kind of the same concept, that reddish brown color urine. Myalgias, which are muscle aches. Okay, so they have the skeletal muscle breakdown and they get these myalgias. Why? Number one, a recent fall, and because of statin use. So 2 common causes of rhabdomyolysis is myelitis is a recent fall, okay? So the muscle breaks down. Sometimes somebody's immobile for a really long time. They fall and they lay there and they're not moving and their muscle starts breaking down. And anybody who uses a statin, what do we tell them when they're using a statin? Okay, be careful. As far as if you have any muscle pains, let somebody know. And then what do? We decrease their dose of statins because statins can cause rhabdo. A urinalysis, there will be protein and red blood cells in the urine because these are big molecules. And now what happens is because the filtration becomes, the filtering changes and it's letting like big molecules through. We see some things in the urine that shouldn't be there. There should not be protein in the urine. There should not be red blood cells in the urine. Those are too big of molecules unless the filtration, something's going on with the filtration in the nephron. Treat with aggressive IV fluids. We want to flush, 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 and obviously nephrology should be consulted. Okay, thank you. And that is the end of part 2. One more part to go for this lecture. Thank you.